So my name's Nathan. I'm the Information Governance Lead for the European Institute for Innovation Through Health Data. So my background, interestingly, I started off a long time ago as a linguist. I studied classics, but I also started working in the area of digital health over 25 years ago now. I started out working in the clinical care area. My expertise was around digital health, around information technology, and that inspired me somewhat to do a master's conversion in computer science because I was really interested to see how digital technology could help revolutionize healthcare. So in looking at doing a PhD, I shifted my focus to information governance and security. And through that, I've had a career spanning both the public, private and third sectors, and increasingly focusing on the impact of new technologies and new ways of doing things, as well as the shift towards regulating those so that they're safe, effective, and they protect patients' and clinicians' data. We're one of the project partners who lead on ethics, data protection, security governance for the project itself. I'm the Work Package 2 lead on the ethics and legal compliance. The main focus of our Working Work Package 2 is to develop a complete understanding of not just what the project's trying to achieve, but how it's going to do it. And a key part of that is understanding the data movements, the data flows that are needed. You know, the work that we're doing in terms of the ethical considerations, in terms of the technical developments, in terms of advisory on how to implement those kinds of aspects, a lot of it does fall down to an understanding of what data's moving where, why, how. So really that understanding is vital for us to do our work. So that does mean going through the nuts and the bolts of what partner is doing what, why, and with what materials, all the while making sure that the research and innovation activities are not hindered. The access to data happens as quickly and as safely as possible, and making sure that we keep the conversation going and then actually listening as well. That's the first rule of information governance, really. It's to listen. The things I'm taking from this project, the things that I've learned, both on a personal and a professional level, are around making sure that actually, when you have doubts, when you're not sure about a particular position, that's okay. Sometimes you've got to be the first person to say, I'm not clear on this. And I think what's been particularly lovely about GenoMed is that I feel like I'm in a group that will nurture understanding. They'll take their wealth of experience, and truly I'm overwhelmed at how many of the partners have worked. You know, they really have an experience that's humbling and a knowledge about the disease area or the interaction with participants and patients, or in terms of process and due process. GenoMed's been an excellent example of a cohesive and collegiate and frankly an enjoyable consortium to work with. So that means we have an innovative spirit, and frankly I think information governance, data protection, ethics approaches need to innovate as well. You can't go back to old methods that were obtrusive when frankly the industries are surging ahead with new methodologies. So keeping abreast is really important. You need to have a good, robust foundation and process for moving forward.